Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. I want to get back and continue my series on building your cancer survivorship follow up care team. And this one is going to be a little unusual. It's actually one of my newest members to my team in the past 3 years that it was just added, and it pertains to the eyes. I never saw this one coming because my eyes were not in the field of radiation, and you don't expect chemotherapy to have any kind of impact on the eyes, but it turns out that it does. Now, I have regular eye exams, and I see an optometrist for that who, just tells me what glasses I need and, if I'm going to wear contacts. However, the last visit that I had with him many years ago, he had mentioned something about the eyes when he did the scope test with me or whatever. They were looking for, I guess, giving me the retinopathy test for the diabetes that I have also developed in my cancer survivorship. He had mentioned something about a thinning of the arteries in my eyes. Couldn't really comment much more on that. And I really didn't think that much more about it. However, during a visit with my endocrinologist 3 years ago, she wanted her own retinopathy test done and had insisted on me going to see an ophthalmologist. So, what's the difference between an optometrist and an ophthalmologist? And I'm going to get a little tongue twisted when you say that. An optometrist is basically a doctor of optometry. And basically, they focus on just primary eye care, eye exams. In some cases, they may treat for some disease, like with eye drops or things like that. Treatments of eye infections. But basically, vision screening. They can't perform surgery, whereas an ophthalmologist is a medical doctor. Uh, they have their focus is more on medical and surgical care for all eye conditions and diseases. So of course, seeing a doctor like that, just like when I got thrown off being sent to an oncologist, to the whole thing with my cardiac stress test. Okay, I got it. Ophthalmologist, the eyes, it's going to be something serious or whatever. Um, they do pretty much the same thing when I go for these visits, routine eye exams. However, they're a lot more in depth. And I wish I could go into the various diagnoses that they've hit me with. Um, I really have a hard time even pronouncing them. They've explained to me so much more of what's going on with my eyes. Clearly, what the optometrist saw, that provides an answer to that. It also provides another answer that it does appear that I'm losing vision. My eyesight is getting worse, probably a lot quicker than what I realized. That I have several pair of glasses that are basically useless. I have the transition lenses for like the bifocals and things like that, and I just can't do them anymore. Um, However, what I'm told, uh, I'll explain how this all came about. Um, when this ophthalmologist looked inside my eyes, a question came out that I wasn't expecting, and this is how I'm tying it to my cancer survivorship. She had asked if I was on high dose prednisone, and I was kind of shocked, and I said yes, I was. It was part of my chemotherapy regimen for 8 months back in 1988. Why? And that's when she described some of the things going on with my eye. Um, Much of it revolving around the retina, and some other things that are going on there with proteins. Looks like I'm developing some cataracts that are related to it. So basically, the only option available will eventually be surgery to deal with it, if that's possible. The conditions are not reversible, but these are things that need to be followed up on So I do have these appointments with this ophthalmologist every 6 months, where they do some more scans, look more into my eyes and stuff, and decide when is going to be the time that a decision needs to be made on if and when my vision can be saved. But this is just a reminder, if high dose prednisone is part of your cancer care, or any other chronic thing that you're taking, if it's a high dose of prednisone for long term, you really need to be followed up, you know, long term into your life. Get your eye exam done when you're, before you do the prednisone. Get your eye exam done after you're done with it, so that you have a baseline of where your eyes are at, and then just be diligent and follow up with your eyes every year, every 2 years, or whatever, as long as nothing's wrong. If you do start seeing something, you may need to be seen more frequently. But you do want to see an ophthalmologist who may be better qualified to pick up these things that are going wrong. Like I said, I'm dealing with 3 or 4 things going on with my eyes right now, so I'm still trying to understand them. I do have an appointment coming up in a month. That's when my 6 months is up. So I'm hoping for a little more clarification on the things that I'm dealing with. But for now, I can still see everybody. I can see all the comments that you send my way, and I do appreciate it. I do appreciate your liking and commenting and sharing, Paul's Heart. Like I said, all I'm trying to do is make a difference to somebody who's looking for information on how to get through their survivorship of cancer. It can be done. You just don't hear about it unless you're watching TikTok and Paul's Heart. Until next time, this is Paul's Heart.